Alright, so I got my palpation video now. So first off, we are going to compare bilaterally. We're going to look at swelling, the edema, skin temperature, skin texture, any abnormalities that they have, point tenderness, and crepitus if it's present. Then we're going to look at anterior. Got my test subject with me.
Hello, hello.
So we are going to look at anteriorly, we're going to look at the ASIS level. We're going to look at the inguinal area down in here. We're going to look at the iliac crests up at the top here. McBurney's point, which is on the right abdomen between the umbilicus and the right ASIS. We got the femoral lymph nodes in that area as well. The greater trochanter, which is out here in the hip bone if you would flay it right there. We got the femoral triangle right in here. So you got the inguinal ligament as the superior, the sartorius, the adductor longus, and you got the femoral nerve, artery, and vein. And then you got the abdominal muscles. Posteriorly, turn him around. We got the PSIS levels right here. We have the spinosis process of the thoracic spine. So T1. So we'll find up here C6, C7, and then the next one right there is going to be T1. And then we have L1. So you'll find the PSIS level here. Go in there and then follow it up till we find L1, which is going to be right here. It should be in line with the umbilicus. And then we have the transverse processes of the lumbar thoracic. So it's going to be on the edge here. So we got the spinosis process right down the middle. Transverse process a little wider. The facet joints are going to be a little anterior, posterior, and a little closer to the midline. We have the sacrum, which is down back here. The ischial tuberosity, which is up in the butt there. The sciatic nerve, which is going to come down through the back of the leg. The paravertebral muscles, which go along the spine all the way up into the cervical region. And then the glute muscles. We're just going to do the range of motion as well right now. I'm going to be using this little thing here with a pen. This is the best I got. So we'll have this edge as the stable arm. My pen will be the movable arm, and we'll use that as the fulcrum. We're going to test uninvolved first, compare bilaterally, weight-bearing, non-weight-bearing if we need to. I always do passive range of motion first, then we're going to go into active range of motion. So we have trunk flexion and trunk extension first, which I would use an inclinometer, but I don't have one. But what I would do to measure that is I'd find L1 back here. And if this is the inclinometer, I would set it up at L1. I would set it up right at L1, and I would have him flex down, and it would tell me the range, and he should be around 80 for that. And then I would have him go back up, reset it, and have him extend, and he should get around 25 for that one. We're going to do lateral flexion, so you face that way. So this, again, we're going to find L1 here. And what we'll do is the stable arm will be in line with the body. Movable arm will be in line with the spine. And I'll have you laterally flex to one side, like that. And movable arm will follow the spine like this. And he should be around 35 degrees for that. Next, we have trunk rotation. So I'll have you sit down in the chair, Drew. Yeah, face that way. kind of face.
Yeah.
I'll get behind you. So this one, what I would do is I would have head straight. I'll have my stable arm in line with the spine of the scap or the AC joint on this side, and I'll have the movable arm in line with the other side. And so what I'll have you do is I'll have you like just twist your body like that.
Mm-hmm.
And my stable arm on this side, so the side you can't see, is going to stay at that spine of the scapula position. My movable arm is going to follow this spine of the scap, and the fulcrum is right at the top of his head. So you can go ahead and move, Drew.
Mm-hmm.
So I'll follow it like that. And the angle you'd end up getting would be something like this here. So it should be close to 45 degrees from that twisting motion. And then we also have the combo movements. So lateral flexion, trunk flexion, lateral flexion, trunk extension, and then trunk extension with rotation. And then we have the resisted range of motion. I'm going to do that in the next video so it's not as long.